Welcome, and thank you for taking time today to view this important information regarding the safe and effective use of 3M Duraprep surgical solution. Reducing the risk of infection following surgical procedures is a team effort. One means of minimizing that risk is by decreasing the level of both transient and resident flora on a patient's skin, and by preventing migration of bacteria into the surgical wound. 3M Infection Prevention Division provides products that assist in reducing and controlling skin bacteria. Today we're focusing on 3M Duraprep surgical solution, considered by many to be the gold standard in patient prepping. It has been available and used in more than 25 million surgical procedures since its introduction in 1988. As of 2006, Duraprep solution has received FDA approval as a patient preoperative skin prep. You may be wondering why, since Duraprep solution is not new. When Duraprep solution was introduced in 1988, it was marketed pursuant to the FDA regulations at that time. In 1994, those regulations changed when the FDA published the tentative final monograph for healthcare antiseptic drug products, or TFM. After discussions with the FDA about the unique film-forming polymer in Duraprep solution, 3M made the decision to file a new drug application, or NDA. Because the iodophore in Duraprep solution is truly novel, the FDA requested that 3M submit to the United States Adopted Name Council, or USAN, a request for a unique chemical name. This name clearly identifies and differentiates the iodophore used in Duraprep solution from traditional povidone-iodine and other buffered formulations. The approved USAN name for the 3M proprietary iodine acrylate copolymer is iodine povacrylex. There are no changes to the formulation. Duraprep solution contains two broad-spectrum antimicrobial agents, alcohol for quick kill and iodine povacrylex for long-lasting antimicrobial activity to create a unique one-step prepping system. It's fast and easy to apply, provides rapid bacterial kill, has persistent activity for at least 48 hours against resident bacteria, remains effective after blood and saline challenge, and offers enhanced drape adhesion. Because Duraprep solution contains alcohol, it is flammable until dry. Therefore, to prevent fire, special consideration must be taken. Do not drape or use around ignition sources such as electrosurgery until completely dry. Minimum of 3 minutes on hairless skin, up to 1 hour in hair. Do not allow to pool. Remove any solution-stained materials. Avoid getting solution into hair. Wet hair is flammable. Hair may take up to 1 hour to dry. If this occurs, wipe hair with towel and allow solution to dry. Note that the FDA has issued a class change for alcohol-based skin preparations that includes a new dry time requirement when prepping in hairy areas. Dry time in hair will be much longer and may take up to 1 hour to dry. This FDA-required labeling change will take effect for Duraprep solution in February 2010. 3M Duraprep surgical solution was created with safety and efficacy in mind. Its fast and long-lasting microbial kill rates are well documented. As a matter of fact, in a 2009 published study examining the effect of surgical preps on the rate of surgical site infections, patients prepped with Duraprep solution had statistically significant lower surgical site infection rates, 4.8%, than those prepped with Chloroprep, 8.2%. Duraprep solution, the proof is in the outcome. And its self-contained unit dose applicator and limited volume of solution are important safety features. So is the sponge, which helps control delivery of the solution. And 3M provides clear instructions for use, plus educational in-service programs and training videos like this one. During this video program, we will demonstrate safe and effective skin prepping using Duraprep solution. When prepping any area of a patient's anatomy, careful assessment of the skin is the first step. It's important that the skin is intact, clean, dry, and free of lotion, powder, dirt, or soap. Do not use Duraprep solution in or near eyes, in ears, in open wounds, or on mucous membranes. Do not use Duraprep solution on patients with known allergies to iodine or any ingredient in this product. Because infants less than 2 months of age have skin that is more permeable, the FDA requires a warning regarding absorption and irritation on all skin preps that are FDA approved. For Duraprep solution, the warning is, do not use on infants less than 2 months old due to the risk of excessive irritation and transient hypothyroidism. In addition, when using this product, use with caution in women who are breastfeeding due to the potential for transient hypothyroidism in the nursing newborn. Many of the preps marketed under the TFM also include a warning regarding use on infants. Given this information, the physician must then make a risk assessment and determine the course of action. When hair removal is necessary, use a surgical clipper outside the operating room just prior to surgery. Clinical studies clearly show that shaving produces nicks, cuts, and microscopic epidermal injuries that can permit bacterial contamination at the operative site. Clipping helps reduce the risk of surgical site infection that can delay healing and lead to a costly, prolonged hospital stay. The size of the area to be prepped is another important consideration. AORN guidelines state that the prepped area should be large enough to accommodate extension of the incision, the need for additional incisions, and all potential drain sites. The prep area should also be large enough to avoid wound contamination by inadvertent drape movement during the procedure. Duraprep surgical solution is available in 2 sizes. The 8630 product contains 26 mLs, which covers a 15 by 30 inch area, or 450 square inches. For most procedures, 1 applicator will be sufficient to complete the prep. Certain procedures may require more than 1 applicator. For example, 2 8630 applicators are often used for a total hip, and 3 are typically used for a cardiac bypass procedure. If a second applicator is needed to complete the prep, begin prepping where you left off. Do not go back over the previously prepped area. Do not use the 26 ml applicator for head and neck surgeries. A small applicator is available for these and other procedures where the prep area is approximately 8 by 10 inches or less. The 8635 product contains 6 mLs and covers at least an 8 by 10 inch area. This size is ideal for angiography, head and neck procedures, and many minor surgeries. To activate the 8630 product, hold the sponge end parallel to the floor and press the cap. Hold the applicator in this position so the solution flows uniformly into the sponge. When the level reaches the indicator line on the applicator, you're ready to begin. To activate the 8635 applicator, hold the sponge in a similar parallel position and snap the lever. Allow all of the fluid to flow into the sponge before prepping. The basic principles of prepping apply to Duraprep solution from incision site outward and from clean to dirty. Now let's move on to demonstrate proper application. Once the applicator has been activated and the solution has reached the go line, start at the incision site and paint with light overlapping strokes, moving out toward the periphery. Remember, paint, do not scrub. Use light pressure and paint a single uniform application. Do not go back over an area once it has been prepped. If dripping or pooling occurs during application, immediately blot with the sponge applicator and continue to apply a uniform coat. Good fluid control technique reduces the risk of flammability and minimizes the potential for chemical burns. Duraprep solution begins killing on contact, and a single coat is sufficient to provide efficacy. If applied too heavily, it will take longer to dry and has more potential to run or pool. Do not use a towel to blot the solution dry, because blotting removes the prep and may reduce immediate efficacy and/or persistent activity. Duraprep solution is visible on a variety of skin tones. As the solution dries, minimum of 3 minutes on hairless skin, up to 1 hour in hair, you will see it change from a wet, shiny surface to a dull or matte film. This change is an indication that the solution is dry. When the Duraprep solution is dry, it is a water-insoluble film that resists being washed off by blood and saline during surgery. Remember, Duraprep solution contains alcohol and it's flammable until dry. A minimum of 3 minutes on hairless skin, up to 1 hour in hair. To reduce the risk of fire, it is essential to check for pooled solution or stained articles on or under the patient when the prep is complete. Use sterile gauze to wick any pooling on the patient. Allow Duraprep solution to completely dry and remove solution-stained materials before applying drapes and/or using cautery. Once the Duraprep solution is dried, you are ready to drape. Studies document that Duraprep film significantly improves incised drape adhesion to the wound edge. This helps maintain a sterile operative surface throughout surgery. Now let's look at how to safely and effectively prep some special areas. Because of body contours, prepping the head and neck area requires special consideration to avoid dripping and pooling. Prep towels should be tucked under one or both sides of the neck as required by the prep area to catch any dripping. Do not use the 26 ml applicator for head and neck surgeries. Use a small applicator, which contains 6 mLs and covers at least an 8 by 10 inch area. When the prep is complete, remove the prep towels. Then, check for pooling or solution-stained articles on and under the patient. Remove articles that have absorbed prep solution and replace them if necessary. Use sterile gauze to wick any pooling. Be certain Duraprep solution is dry before draping and/or using electrosurgery. If prep accidentally drips into hair, wipe the hair with a towel and allow solution to dry. Wet hair is flammable. Hair may take up to 1 hour to dry. When the procedure requires a low transverse or fan and steel incision, begin the prep over the incision line. Then make one pass below the incision, but do not go down into the groin. Continue prepping above the incision working up and then out to the periphery. Next, prep the upper thighs, working sequentially into the groin, which is prepped last. When prepping toes, use the applicator to separate them, and then prep around and in between them. Using a sterile gloved hand, keep the toes slightly apart until completely dry to keep them from sticking together. This same practice should also be used on fingers or other body parts where the skin folds may stick together. When prepping an extremity, first isolate the tourniquet. This will help keep the equipment dry and prevent prep solution from soaking the padding. The incision area should be prepped first. Use either a circumferential or a back and forth technique, working out from the incision area and around the extremity. Remove any solution-stained materials and replace if necessary. Duraprep solution is intended to be left on the skin and will gradually wear away. Patient take-home instructions are included in each Duraprep solution kit. If you want to remove the Duraprep film, 3M Remover Lotion provides the best method. Simply apply the lotion and wipe it away when you start to see the film color disappear. It's fast, requires no scrubbing, and is gentle since it contains skin moisturizers and conditioners. 3M Remover Lotion also removes traditional iodine, tincture of benzoin, and materials soluble in alcohol. An alternate method to remove Duraprep solution is to use alcohol-saturated flats and gently scrub the film away. Thank you for watching this video presentation. 3M's commitment is to support your efforts to use Duraprep solution safely and effectively. This video is part of that effort, and so are the instructions for use, policies and procedures, and other support materials we provide. If you have additional questions regarding the use of Duraprep solution, please contact your local sales representative or Duraprep Solutions Technical Support at 1-800-228-3957. Duraprep solution is easy to apply, is effective in a single painted coat at suppressing bacterial growth, and the Duraprep film provides enhanced drape adhesion. The combination of isopropyl alcohol and iodine povacrylex works to create a unique and very effective one-step skin prepping system. Duraprep surgical solution, considered by many clinicians to be the gold standard in patient prepping.